And then you do the submental lymph nodes as well as the submandibular. And then you're going to work all the way back to postauricular and preauricular lymph nodes. Then you're going to ask your patient to clench and see the masseter muscle, as well as clenching again for the temporalis. You're going to feel for the parotid gland to see if it's enlarged at all. You can hold your hand lightly against their throat and ask them to swallow. This is to note the normal up and down movement of the larynx. And when you palpate for the thyroid gland, you have one hand steady while the other is palpating to see if it's enlarged. And then you also turn your patient's head from one side to the other for the sternocleidomastoid. And you go all the way down to the cervical lymph nodes. And you do this on both sides. And then you're going to ask your patient to open as wide as they can. And then you're going to ask them to close and check for any crepitus, popping, or deviation in pain from the patient in their TMJ. You're also going to look at their general appearance, see if they have any abnormalities on their skin or just spots that haven't gone away. And then now we're going to move into the First, you're going to observe the outer lips and see if there's any irregularities. And if you could open. You're going to observe the labial mucosa and palpate it for any lumps, as well as the top. And then you're going to observe the buccal mucosa on both sides. You're going to palpate the retromandibular pad and the maxillary tuberosities. You're going to palpate the floor of the mouth, and for this one, you're going to have the other hand beneath it to stabilize it for any tori, as well as. And if you could stick out your tongue and say, ah, ah. Then we look at the soft palate and the tonsils to make sure they're not enlarged or red. And if you could stick out your tongue again. Then you're going to look at the sides of the tongue. And if you could stick it to the top of your mouth to look at the ventral surface of the tongue. And also palpate it. And
kind of just above the collarbones. And first thing I want to do is I want to try to find a place where my fingers can fall naturally, and just all I'm doing right now is just checking for symmetry. There's gonna be all types of crazy bumps in here, okay? But I want to make sure that there's symmetry all the way up. I'm kind of squeezing, I kind of push back and forth. I go all the way to the thyroid cartilage, and I kind of rub my fingers around both sides of the thyroid cartilage to make sure that there's nothing sticking off the thyroid. Sometimes you feel like a little bump on one side or not the other. That's a sign that you want to make sure that you ask them about their physician as they look at this, because we're not going to obviously treat this. We're just trying to make sure the patients know that they need to go see somebody. But so check the thyroid cartilage. What I do is I kind of move it back and forth like this to make sure it's movable. Okay. Sometimes you feel or see things when you push it around, because it should be able to be freely movable when you press it back and forth. Then what I do is I kind of put my fingers against the skin and I kind of pull up like this. What I'm doing is I'm trying to trap any lymph nodes underneath my fingers as I go up, because if you find one lymph node on one side, and you'll find one, and it's just kind of a you'll feel one on the other side too. If you find them on both sides, that's great. If you find them on one side, a lot of times you'll find them on just one side. But you just got to make sure that you don't see anything going on, or you ask the patient if you've had any symptoms or anything like that. The next thing I do is, a lot of times they ask you like to palpate all the muscles of mastication and all the head and neck muscles. But what I do is I just come up here and I start pressing on the masseters a little bit to see if that makes the patient jump at all. Because if that makes them jump at all, that means they've got really hot masseters. Probably they're clenching and grinding at nighttime. Okay, so I kind of come up here, and if they don't make any noises or anything like that, then I just put my finger right above where the condyles are. And sometimes I'll say, oh.
I'm just looking for any areas that may stand out as being different from one side to the other. I'll have you open and close now. And I want you to move your jaw to the right now. Open and move to the right. Close, open, and move to the left. And now bring your jaw forward. Okay. Do you feel any tenderness or pain with that?
No.
Okay, excellent. I'm just going to check your glands in here, and I'm going to have you clench your teeth together now. Good. Excellent. Now I'm going to check your lymph nodes. Start underneath your chin and then along your jawbone. And I'm going to have you now put your chin down a little bit and ear over to your right shoulder. I'm going to press a little bit more firmly here. And then the other side, chin down, ear over to the shoulder. I'm going to press a little bit more firmly here. That's good. Next area, I'll have you put your chin down a little bit. And again, I'm continuing on to check your lymph nodes. I'll have you turn to your left. Good. And then I'll have you look straight ahead. And chin down a little bit and turn to your right.
De votre visage. Je vais voir s'il n'y a pas de cicatrice.
Lors de l'inspection extra-orale, le praticien recherche toute anomalie, asymétrie du visage, des articulations temporomandibulaires réalisées en plaçant les doigts sur les condyles mandibulaires afin de mettre en évidence d'éventuels claquements ou ressauts articulaires lors de l'ouverture ou de la fermeture buccale. Le praticien évalue l'ouverture buccale du patient et son éventuelle limitation signant un trismus, pouvant avoir pour origine un processus infectieux.
On va regarder.
L'ouverture buccale est comparée avec la...
Now I have Jeremiah positioned in a very nice way. He's at a good height. I'm able to get a nice, even look at his face and see into his mouth nicely without having to bend down too much. So we're both pretty comfortable, right? All right, Jeremiah, the first thing I'm going to do is I'm going to put my gloves on. That's for my safety and yours, even though my hands are clean. The first thing we're going to look at, Jeremiah, is just the symmetry of your face. And I'm noticing that your facial structures look nice and symmetrical. Your lips are nice and symmetrical. Everything's moving at a nice, even and symmetrical pace, so I'm not seeing any neurological problems. Good. His molars are aligned. Good. I'm not seeing an overbite or an underbite. It's looking really nice. I'm seeing that Jeremiah has all of his teeth right now. All right, Jeremiah, that's it for the teeth. So now we're going to move on to the lips, okay? All right, go ahead, and I want you to pucker your lips and say, ooh.
The thing I'm going to do, I'm going to explain this all to you as I do it, okay? I'm going to have you open and close for me. And close and open and close. Excellent. What we're checking for is any TMJ issues in the joint, any clicking or popping. Go ahead and squeeze your teeth together for me. Perfect. And relax. These are the masseter muscles. These are some of the main chewing muscles. Does this hurt at all when I press on this? Excellent. And go ahead and squeeze again together for me and relax. Perfect. These are the temporalis muscles. Do you ever get any headaches up in this area?
On occasion.
Do they start in the morning?
Yeah.
Okay. What happens is when you clench or grind at night, this muscle connects right up to this temporalis muscle. Therefore, you're putting some extra stress on this, and sometimes that can be TMJ related. The next thing I'm going to do, sorry, keep moving your head. I'm going to check for any lumps or bumps in the lymph nodes. I'm going to check the lymph nodes under the cheek first. Let me know if anything is tender or hurts. And what about under here? Is there anything sore under here? Perfect. I'm going to check some of the lymph nodes under the chin. Perfect. Don't go around the ears. Any of this tender at all? Perfect. Let me go and have you turn your head to the left for me. I'm going to check. And to the right. Excellent. Are you doing okay? Now look straight forward for me. Perfect. Any of that tender at all?
Nope.
Excellent. We're going to go ahead and check your thyroid and go ahead and swallow for me. Perfect. Yeah, I'm going to go ahead and check behind your ears. Do you make sure you wear sunscreen? Excellent. And to left. This is one place you typically don't see at home by yourself. So I like to check and make sure there's no discoloring in the tissue. Excellent. All around the teeth and the cheeks. You definitely clench and grind, don't you? Got some marks on the side of your cheek. Everything looks okay. But definitely signs of clenching. And I want you to open really big for me and put your tongue to the top of your mouth. Excellent.
The muscles under the chin. Okay, no, keep pulsing. Good. Good. All right, now I'm going to be looking at the masseter muscle. Okay, so smile really hard. Good. Good. So I'm feeling it palpate. All right, and I'm also going to be feeling for your muscles in your temporal lobes. I'm gonna good. Keep going. Just keep smiling. You don't have to raise your eyebrows, but just smile and let go. Ready? Good. Okay, now I'm gonna have you close your eyes. I'm gonna be checking for sensation on your forehead and different areas of your face. All right, now you just tell me if you feel anything. I want you to face this way. Face the camera. Thank you. You feel any?
I do.
Okay.
Yeah. 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 Yeah.
Good.
Checking the lymph nodes all along the lower jaw, behind the ears, and on the sides of the neck to see if there are any lymph nodes that are swollen. If there were some, it's a sign of inflammation in the mouth.
We're going to start with what we call the neck caress. So you can have the patient put their chin up so that you can visualize everything, and you want firm pressure, feeling for lymph nodes, swollen glands. Sometimes patients have more skin, more tissue. When that's the case, just make sure you really hold the skin taut so that you can feel everything, okay? And it's okay, sometimes you have to have the patient move your head to the side just a bit so that you can really feel it and have the skin taut. Okay, great. So that's the neck caress. The next thing we're going to do is what we call just the tongue with the gauze. So what I have Randy do is take a piece of 2x4, fold it in half, and tell the patient to stick their tongue out. Great. You're looking for the sides of the tongue, making sure that it looks pink, healthy, no red, white lesions. Right? Have tongue to the roof of the mouth. Good. The next thing we're going to do is the lip and cheek.
Not the pressure pushing the skin, it is a vibration, and he was able to recognize the vibration. Ahmed? So, ايش does it on? Vibration. Tell me when it stops. I feel it, he feels it. Ahmed, do you still have it?
Yeah.
I still feel the vibration. I'm comparing my threshold to his threshold.
Just stop.
Stop now?
Yeah.
And it stopped in my hand. So I'm again down.
Okay.
This is up. Okay. I'm going to move the finger here. Close your eyes. So again, his eyes are closed. Now?
Down.
Okay. Now?
Down.
Now?
Up.
Now?
Down.
Now?
Up.
Now?
Up.
Okay. You can, you right? I'm going to do the same here, huh? Now?
Down.
Now?
Down.
Now?
Down.
Now?
Up.
Now?
Up.
Again, he tried to be random. He was able to pick all the movements. Sometimes because he was able to pick the large movement, we may, and if you suspect there's an impairment of the vibration and perception sensation, you may do a small movement. We'll do it again. Now?
Down.
Now?
Down.
Now?
Up.
Okay. And he will be able to, now close your eyes. Close your eyes. Now?
Down.
Now?
Up.
Now?
Up.
Now?
Up.
Okay. Now?
Down.
So this is a normal proprioception.
Tell me if you feel any tenderness or pain for anywhere I palpate, okay?
Okay.
Everything looks normal. There's no pain or tenderness to any of my touch. Good. Now I'm just going to go ahead and feel your pulse to make sure everything looks normal. Good. Now this side. Okay, good. So now what I'm going to do is I'm going to go your pants a little bit just so I can get a look here. Okay. No pain or tenderness? Nope. Good. I'm just going to go ahead and have you stick your big toe up for me as high as you can to the sky. Good. Go ahead and relax your foot now. check this foot as well. Okay, I'm gonna feel your pulse here as well. Go ahead and pull on your arms and try to open this, and you go ahead and resist me, okay? I'm gonna do it with both hands. Good, and I'm gonna do the opposite, okay? I'm gonna push, I'm gonna try to close the angle, and you try to keep it, resist me, okay? Good, okay? Now I'm gonna go ahead and ask you to lift your leg off the bench. I'm gonna go ahead and resist. Good, now the same as, okay, good. Now I'm gonna have you do, Ben, is I'm gonna have you clench your teeth, like bite down for me. And I'm going to feel the masseter muscle, which is right there. It should be a nice firm ball. And then feel the temporal muscle. Now what I'm going to do to also test that nerve is have him try to open his mouth against resistance. So try to do that for me. Okay, and he can do that. Now, while we're here, we're going to go ahead and feel the temporal mandibular joint. And we're going to feel right here. And I'm going to have you open and close your mouth. And I'm feeling for any grating or clicking sensations. And I feel none. Then we're going to palpate the sinuses. And I'm going to put pressure on these two sinuses right here. And you tell me if you feel any pain, okay? So the maxillary no.
And the frontal.
No.
Next, we're moving down to the eyes, and we're going to inspect the eyes first. And we're looking at several things. We're looking at the eyelid. We're looking at the sclera, which is the white of the eyes. We're looking at the iris. We're looking at the pupil, and we're looking at the conjunctiva. Next, we're going to palpate on the ear. We're just going to move it around. And Ben, tell me if you have any tenderness whenever I do that. And feel any abnormal masses or lesions, and then move the targets a little bit. Does that hurt or anything like that? No. Okay, so no pain or tenderness. Then we're going to palpate the mastoid process, which is the big hump behind the ear, and we're looking at it. Is it swollen? Is there any redness? And whenever I touch on it, Ben, does it hurt? Yeah. Okay, and just see if the patient reports any tenderness with that. Then while you're there, you can use the otoscope to inspect the tympanic membrane. And remember, the tympanic membrane should be a pearly gray translucent color and should be shiny. So for an adult, you're going to pull the pin of the ear up and back. And we're just going to inspect it. And there we go. We're going to start at the pre-auricular, which is right in front of the ears. Then we're going to go to the back of the ears, the post-auricular. Then we're going to go to the occipital, the parotid, jugulo-digastric. Then we're going to go to the submandibular, and then the submental. Then we're going to go to the superficial cervical, and then we're going to make our way down to the deep cervical chain. Any tenderness so far? Then we're going to go to the posterior cervical, and then right above the clavicle, we're going to go to the supraclavicular. And did not feel anything. Floor. Next, I'm going to check the capillary refill on his toes, just like how we did with the fingers by pushing down. In less than 2 seconds, check the other one. Okay, now I'm going to have him push against my hands. Push against my hands, Dan. Okay, good job. Now I'm going to have you raise your legs against resistance. Good job. Now we're going to check the Babinski reflex, and you can use your reflex hammer for this and use the end of it, or you can use your finger if you don't have that. And what we're going to do is we're going to take this up through the ball of the foot and curve it, and we're looking for the toes to curl in, which would be a negative normal response. So let's check that. Okay. Okay, and that was normal. Then we're going to doff our gloves and...
This is down. Close your eyes for me. Which way is the toe going?
Down.
Good. And now?
Off.
And now?
Off.
Great. And on this side, which way is the toe going now?
Off.
And now?
Down.
And now?
Down.
Great. You can open your eyes.
Headaches.
La centrale d'Ensisheim ne possède pas de lieu d'accueil pour les détenus transférés.